You're listening to Health Professional Radio. My name is Wayne Bucklar, and today joining me is a previous colleague who's been with us before, Michael Peachey. Now, Michael's the Chief Executive Officer at Wellness and Lifestyle Aged Care Services, and Michael joins us today to tell us a little bit about what Wellness and Lifestyle Aged Care Services do, and then to bring to us some news about some changes that's happening in the aged care sector. Michael, welcome to the program.
Good afternoon, Wayne.
Now, Michael, last time we were on air with us, you spoke about Wellness and Lifestyle Aged Care Services, but many of our listeners may have either forgotten that, heaven forbid, because it was a wonderful interview, or they might have missed that interview. So can you fill us in again about what it is you do and what geographic footprint you work in?
No problems, Wayne. WNL or WNL Aged Care Services, we deliver specialist aged care services to improve the quality of life for older Australians, providing a one-stop shop for aged and community care. Our allied health services include physiotherapy, podiatry, occupational therapy, speech pathology, and dietetics. We provide these services to both residential aged care facilities and also community clients in their own home.
So, Michael, they all sound like what I would think of as ancillary services around actual residential care. Do you provide the residential care as well?
No, Wayne. So a lot of organisations have found it more feasible for them to outsource those ancillary functions to people who specialise in aged care. So many aged care organisations, rather than employ those allied health professionals, they'd rather engage us instead. Yeah,
that certainly makes a lot of sense because it does allow for specialisation then.
Correct.
So, Michael, what footprint do you service geographically? Whereabouts are you located, and how far do your services extend?
So, WNL, we provide services in all states in Australia and also territories, as well as providing services to residential aged care facilities, not just in metropolitan areas, but we also provide services to regional, rural and remote settings. In terms of the size of our firm, we're one of the largest allied health providers across Australia, and several hundred staff, including physios, podiatrists, OTs, speech paths and dietitians, as well as the support head office here in Adelaide with our HR, IT, etc. back here.
I see. Now, Michael, most of our audience are clinicians of one kind or another, and roughly 50-50. Half of them work in acute care and the other half work in aged care. As a result of having a chat with you today, is there a message for clinicians that you'd like them to hear?
Yeah, so look, in light of the government's recent media release regarding changes to the way aged care is funded, the most topical service that clinical staff and patients should really know about is physiotherapy and occupational therapy services. Here at WNL, our focus is to improve resident pain management and mobility outcomes in a way that's consistent, transparent, and it supports facilities' both accreditation and funding needs. So although some facilities provide pain management clinics for residents and they receive funding for this, for us improving the quality of residents' lives is actually more than just pain management. Every time we're providing these interventions, we're always looking for innovative ways to routinely incorporate interventions that optimise mobility, dexterity and rehabilitation, as opposed to just ticking a box in relation to pain management for funding.
Yes, it's a complex sector, and I often feel sorry for everyone involved in terms of the complexity of having care for ageing and elderly Australians, both from a legislative point of view, from a service delivery point of view, and from the point of view of ageing Australians who are trying to take advantage and live in this system as well.
Yeah, absolutely. And our point of view is that if we partner with our clients to structure our services correctly, all residents can then actually receive the interventions they need in a way that actually supports accreditation, but also meets all funding requirements, and it's cost effective for both the resident and the facility. So pretty much our philosophy is that all residents should have the opportunity to optimise their mobility and dexterity, and they should be as free from pain as possible.
Now, Michael, my favourite question in every interview is about misconceptions. And in every industry there are misconceptions. What are the misconceptions for you, be they with clients, patients? Where are the misconceptions that drive you nuts and keep you awake at night?
I guess one of the biggest misconceptions about physiotherapists and occupational therapists working in aged care is that in some cases it's thought that they come in and they deliver pain management to residents with minimal clinical outcomes for the resident, and it's just to support an organisation's funding. But for us, if the care is first provided and then it's also documented in the right way, this will actually support the clinical needs as well as the facility's accreditation and funding. And although our transparent reporting demonstrates that WNL as an organisation doesn't believe in over-servicing, there's been some negative press in the media recently related to how facilities receive funding to provide that complex pain management for residents in aged care. And it's been announced that this may be reduced. So our biggest concern is that these changes may limit the amount of funding for care being received by facilities and ultimately affect resident outcomes.
Yes, I can see why you'd be concerned about that. And the press reports that have been surfaced about over-servicing, Michael, do you think that's a real concern, or is it an issue of documentation and management to meet the system requirements?
Yeah, I believe in the second answer there. For us, we deal with a lot of organisations across Australia and support them to make sure they're receiving all the funding they're eligible for, but not a dollar more and not a dollar less. Mm-hmm. The organisations that we've come across that have actually lost funding at validation hasn't been about overclaiming or fraudulent activity. It's usually been about not necessarily having the administration, so not necessarily just ticking the right boxes, dotting the I's and crossing the T's to satisfy what the government want in terms of the paperwork to support their claims.
Yes, I'm not surprised to hear you say that, because I have previously spoken with some people from the other side of the fence on the legislative side of funding, and they acknowledge as well that one of the difficulties is that sometimes their compliance requirements are actually so onerous that it's a perverse outcome. People are doing what they want, what the government wants them to do, but reporting it is so difficult that it doesn't get reported, and then you have negative outcomes in terms of funding and other things from the government. So it's interesting that you see that problem as well, and I guess it's one of the things that if you're a large systemised organisation, as you are, it makes it a little easier to get your head around.
Absolutely. And so for us, it's about having those systems and processes in place, but having an understanding of the legislation that drives both accreditation and the funding through the ACFI as well, that makes us ensure that we can not only look after the residents, but also support the residential aged care facilities who are ultimately our clients too.
With a little bit of luck today, Michael, we can help just a little bit with that misconception, and hopefully some of our listeners will have heard your words and gone, there's a solution to a problem that I've got. Michael, for people who want to get in touch with you at Wellness and Lifestyles Aged Care Services, what's the best way for them to do that?
The best way is to either email us at contact@wellnesslifestyles.com.au, or they can call us on 1300 952 433.
Now, I'm always getting into trouble when I give phone numbers and don't give people enough notice to get their pencils ready. So fair warning, listeners, pencils ready. That number was 1300 952 433. Michael, I do appreciate your time today. Thanks for making yourself available and for bringing to our attention the issue with changing funding in the aged care sector.
Thanks, Wayne. Have a great day.
Thank you very much. If you've just missed my conversation with Michael Peachey, the CEO of Wellness and Lifestyle Aged Care Services, I've got good news and bad news. The good news is you can look at a transcript on our website. You can also listen to the sound archive on both YouTube and SoundCloud, and there are links to all of those resources on our website at www.hpr.fm. And the bad news is, well, there is no bad news. Enjoy listening to that interview with Michael in our archive if you've missed it live on air. This is Wayne Bucklar, and you're listening to Health Professional Radio.